Hello, my name is Sushma Gokhale, and today we're going to talk about elder care costs and the importance of not cutting costs where diagnostics are concerned, especially for the elderly. And I've been hearing a lot about Kaiser cutting costs, cutting corners on end-of-life elder care. And all of that is very fine, but while many end-of-life procedures are indeed torturous, unnecessary, ineffective, what you want is a high quality of life while you're alive. So we're going to talk about that. What do I mean by a high quality of life? The ability to walk, talk, think, cook your own food, go to the bathroom independently, have laughs with your family and friends. In short, have the life force within you that allows you to do the basic functions of life. And to that end, diagnostics are very, very important. I notice Kaiser, Medicare, etc. are taking very large shortcuts to elder care to cut the enormous end-of-life costs of hospitalization. And that is a fine objective for a business, but there are many end-of-life procedures that are very ludicrous, torturous, unnecessary, and ineffective. But what you do want to ensure is a high quality of life while you are alive. And those are some of the things I feel that are falling through the cracks in our system. So to that end, diagnostic tests are very important. And neither you nor they should cut corners here. They're also cheap. And if you're stuck to the fairly non-invasive ones, they will inform you. To be informed is to have the power to know what you need or don't need. Diagnostic testing, to my mind, is one corner that cannot and should not be cut by Medicare or an HMO. Sorry about that. 50 years ago, very few doctors had heard of Hashimoto's. Now, nearly 40% of the female population seems to have one form or another of hypothyroidism. Hashis or plain vanilla hypothyroidism. And you're all going to grow old and run into similar problems as this 90-year-old did, and I'm going to post her case in the case notes down below in the comments. If you're lucky, you will be diagnosed and treated early, and you will live a good life. If not, you will be sick and disabled for years and then die a very painful death. So this is an epidemic, and yet the gold standard of medicine is hopelessly behind in diagnosing this debilitating disease. That, in my opinion, could be easily cured with diet and the right medication. If it is allowed to fester, untreated, or worse, it's mistreated, with, say, T4 or Synthroid only, many of these women develop successively horrifying symptoms such as megacolon. That's your colon that's filled with, impacted stools and grows bigger and bigger and bigger. And I've heard of doctors going to these women with hypothyroidism and saying, hey, why don't we just cut off your colon? And lo and behold, they cut off 20 inches of their colon, and now they're left without a very, very critical organ. Megacolon is a symptom of severe hypothyroidism. Fibromyalgia, lupus, extreme depression, low heart rate, bradycardia, congestive heart failure, low BP, vertigo, permanent cough that go and don't go away, constipation, tiredness, weight gain, myxedema. Myxedema is a swelling of the body's connective tissues and other ailments. All of these lead to a poor quality of life and finally a very painful death. So women who are hypothyroid, please hear up. Frequently, your doctor's solution is to take out the thyroid or remove the offending colon, so full of impacted fecal matter. But folks, butchering the body is not the answer to a healthy thyroid. Running better diagnostic tests is, for instance, your T4, T3, TSH, reverse T3, looking at the hypothyroid symptoms subjectively even in the absence of positive test results. And this is where your relationship with the doctor comes in. This is where you need to tell the doctor, if they tell you that your TSH is perfectly normal, doctor, I've got all these other symptoms that point to hypothyroidism. Can you help me here? Can you send me to an experienced endocrinologist who has treated cases like mine? Things like BMR tests, resting body temperatures, the Achilles tendon reflex that used to be used 100 years ago to treat hypothyroidism. These are critical tests to measure thyroid activity and function. So what I'm going to pose down under is the study, the case study of a 90-year-old woman who will serve as an example of what happens when basic elder care gets compromised. So this was a 90-year-old woman who had been residing in a nursing home for many, many years. She was brought in for a consultation. The nursing staff and family reported gradually increasing lethargy, depression, diminished mental alertness. She had a history of cerebrovascular accidents, which precipitated admission to the nursing home. The medical chart reflected persistent chronic hyponatremia. Hyponatremia is Latin for low salt, which was unresponsive to fluid restriction. So when you see these symptoms, you want to suspect that the person is not being treated for hypothyroidism. The patient had increasing pulmonary and peripheral edema as a result of congestive heart failure. Treatment with diuretics had failed. Treatment with diuretics for the fluid retention had failed and worsened the sodium depletion. A history of thyroidectomy for goiter in the remote past was discovered. So this is a person whose thyroid was removed. Nobody knew about it. The person was not taking thyroid medication, and she was heading towards a body failure because of thyroid failure. So someone in the nursing home forgot that she had her thyroid removed, and the patient had not received thyroid hormone replacement therapy. She also had a family history of hypothyroidism. Her son had a thyroid goiter. So if you see familial hypothyroidism, if you see your brothers, sisters, nieces, uncles, grandmas having thyroid issues suspected in yourself, a lot of hypothyroid moms confer lack of thyroid to their children. People live in goiter belts where there's not enough iodine, and these children come out with organic hypothyroidism that can sometimes be fulfilled or fixed with iodine and sometimes not forever. The biggest clinical manifestation of hypothyroidism, however, is myxedema. And this means induration, which is hardening and thickening of the skin. And this is attributable to the water binding capacity of the glycosaminoglycans in the papillary and reticular layers. In plain English, this means the outside connective tissue of all your internal organs gets boggy. It gets filled with mucus-like polysaccharides because your smooth muscle to the blood vessels, the smooth muscles outside of the cerebrospinal tubes and the lymphatic tubes is not working. And so these fluids, which were previously moving passively, but with the contraction of your smooth muscles, are no longer moving. So the fluids are going into your surrounding tissues, they are perforating, they're infiltrating the connective tissue outside, and you find that you have edema all over your body, including the legs, the heart, the brain, in your abdominal tissue. There is permeability, increased permeability of your capillary vessels because they have nowhere to go. There's lymphatic obstruction because the lymph has nowhere to go. It cannot be drained. There's perivasculitis. And don't get stressed out or bamboozled by these terms. Perivasculitis simply means an inflammation of the outermost layer of your connective tissue, outside of your organs. That gets gummed up. The acid glycosaminoglycans are also found in the tissues of your tongue, your myocardium. The heart muscle is covered by a myocardium. Your striated muscles are covered in this connective tissue. Your intestines are covered in this connective tissue, which is why people with low thyroid have intestines that don't move, because the connective tissue is messed up. The muscles don't work as well. So what this means is your system starts to shut down as the smooth muscles of your vessels stop working. Your lymph stops moving. Your cerebrospinal fluid bleeds into your surrounding connective tissue instead of moving through the pipes as your metabolism shuts down. Thyroid hormone replacement will reduce these symptoms of the hyaluronic acid concentration in the connective tissue, but a lot of damage is already done. And this could easily be taken care of by appropriate diagnostic testing, especially in elders. Muscle biopsy here shows severe myxedema, type 2 muscle fiber loss and atrophy, and number of increased mitochondria, because they're trying to, like crazy, to make more energy in your body, and the energy making is not working. There's an accumulation of glycogen and lipids in the membranes because they can't flow in or out. About 50% of these myxedema patients, when they're admitted to hospital, die, probably as a result of the stress caused by just the diagnostic and therapeutic interventions encountered during the hospitalization. So you're doing a little bit too little, too late, and you can avoid it at this point. The death rate here is at 50%, and you can avoid it by timely testing, Sorry, I'll try and speak more slowly. But you can avoid all this by timely testing and just making sure that the elders in your life are diagnosed appropriately. If they go to assisted living facilities, they know that they are either hypothyroid, they don't have a thyroid organ, and they're appropriately tested. The dosage is increased as time goes by. And understanding that T4 does not always work. For many people, especially in their 60s, 70s, 80s, and 90s, the body starts degrading the T4. It requires T3 or a ground up bovine or porcine thyroid or a lot of experimentation to get the thyroid working again. And this is a very simple diagnostic tool that saves all sorts of hospitalization costs, that changes quality of life for yourself, the elders in your life. And that is an epidemic that's going to follow us to our grave, because today almost 40-50% of the women out there have low thyroid symptoms of some sort. And I'll post the case history or the case study down under, along with a somewhat abbreviated transcript of this video. So good luck in getting your thyroid tested. You want to test not just for TSH, but T3, reverse T3, thyroid antibodies, the TPOs, and a whole host of other thyroid tests that'll tell you if you're deficient in thyroid. And you want to go to an all-organic diet if you have hypothyroidism of any sort. Hashimoto's is actually a disease of the gut, where you have proteins that go through glyphosate-laden guts, herbicide and pesticide-laden guts that are leaky, permeable, and are not able to appropriately convert the proteins into smaller amino acids before they go into your body. So now you have a condition of these amino acids, large amino acids or large peptides going into your body. Your body is raising an immune response to them, and lo and behold, your body attacks your thyroid and other organs that resemble these protein antigens. So for hypothyroidism, I would recommend a GAP-style diet and a very, very clean diet. Supplementation is not the solution here. If you're dying of hypothyroidism, you need thyroid hormone. If you're getting there, then you need a clean diet, adequate iodine in your body. But if you're an elder, this diagnostic test will save the Medicare and HMOs millions of dollars in hospitalization and give you a good quality of life. Thanks, and here's to your very good health.